welcome to the deep dive. Today we're diving into how AI could change how we predict AMD.
Age-related macular degeneration.
Exactly.
It's a really exciting field with huge potential for early diagnosis and personalized treatment.
And that's so important because we're talking about the leading cause of vision loss in developed countries.
Right, and it's projected to affect almost 300 million people worldwide by 2040, so the impact of this research could be massive.
Okay, so let's start with the basics. How is AMD typically detected now?
Well, currently, ophthalmologists use methods like the Simplified Severity Scale, which looks for specific signs in the retina like drusen.
Drusen?
Yeah, these little yellow deposits. And pigmentary changes.
So looking for like physical clues that something's off?
Yes, but these methods have limitations. They can be subjective, and they don't always catch AMD in its earliest stages.
But yeah, and that's where AI comes in.
Exactly. Researchers are using AI to analyze retinal images, especially OCT scans, which give a detailed cross-section of the retina. AI can pick up on subtle patterns and anomalies that might be invisible to the human eye.
So it's like having a second set of eyes, but these eyes are powered by algorithms.
I like that. And what's even more interesting is the type of AI they're using.
Okay.
It's called unsupervised anomaly detection.
Unsupervised anomaly detection. Okay, break that down for me. What does that even mean?
So instead of training the AI on images of AMD, they're actually training it on images of healthy eyes.
Interesting.
This way the AI learns what a normal retina looks like.
So it's learning to recognize what healthy looks like.
Precisely. Then, when it sees a new image, it can flag anything that deviates from that norm as a potential anomaly, even if it's something doctors haven't seen before.
Wow, so it's like teaching the AI to be a detective, spotting things that are out of place.
Exactly. And to make it even more powerful, they're using a multi-scale approach.
Multi-scale approach?
Yeah, they analyze the image at different magnifications. Kind of like zooming in and out to capture details in various levels.
So it's not just looking at the big picture, it's also paying attention to the tiniest details.
Right, and this is where it gets really technical, but essentially they're using a type of AI called a deep denoising autoencoder.
Deep denoising autoencoder.
Yeah, it learns to filter out noise and focus on the essential structural features of the retina.
So it's like it's learning to see through the clutter and pick out the important anatomical details.
Exactly.
Fascinating. And what happens once the AI spots these anomalies? What then?
Well, the AI then groups these anomalies into categories, some of which can be linked to things like fluid buildup or photoreceptor damage. It's almost like the AI is discovering new types of AMD markers.
That's incredible. So the AI is not only detecting potential problems, but it's also helping us understand AMD better.
Exactly. And the most exciting part is these AI models are incredibly accurate. They're outperforming existing clinical methods and even experienced retinal specialists in predicting AMD progression.
So they're not just doing a good job, they're doing a better job than humans in some cases.
No.
That's impressive. What kind of accuracy are we talking about here?
One study achieved an AUC of 0.944 on a public data set for classifying healthy versus intermediate AMD.
Okay, I have to admit, I don't know what AUC means, but 0.944 sounds like a big deal. So what does this mean for someone listening who might be worried about their own eye health?
It means there's real potential for much earlier diagnosis of AMD in the future. Imagine being able to catch the disease before you even experience any vision loss.
That's a game changer. Early detection could mean preserving your vision for much longer. This is really remarkable stuff.
It is, and it's important to remember that this is just the beginning. As AI technology continues to evolve, we can expect even more breakthroughs in how we predict and treat AMD.
This is definitely a field to watch, but before we get too far ahead of ourselves, I have to ask the question that always comes up with AI. What about the black box issue? How do we know we can trust these predictions if we don't understand how the AI is making them?
That's a valid concern, and researchers are working hard on making these AI models more transparent and understandable.
Okay.
It's crucial for building trust and ensuring these technologies are used responsibly.
So explainability is key. That makes sense. Okay, we've talked about the how of AI prediction, but let's talk about the why. What are the potential benefits of using AI for AMD prediction in the real world?
That's a great question, and there are many potential benefits. We'll dive into those right after a quick break.
Stay tuned, listeners. We'll be right back with more on the exciting potential of AI and AMD prediction.
We'll explore how this technology could lead to earlier intervention, personalized treatment decisions, and maybe even the discovery of new risk factors and disease subtypes.
It's going to be a fascinating discussion. Don't go anywhere.
So we're back, and you're probably wondering how this AI technology could actually benefit you.
Yeah, let's get into the real-world implications. What's the big picture here?
Well, imagine a future where you go for your regular eye checkup, and instead of relying solely on traditional methods, your doctor has access to AI-powered predictions.
Okay, I'm following.
The AI analyzes your retinal images and gives your doctor a detailed risk assessment, telling them how likely you are to develop AMD and how quickly it might progress.
So it's like having a crystal ball for your eye health.
In a way, yes. This information empowers your doctor to make more personalized treatment decisions.
So what would that look like? Give me an example.
Let's say the AI predicts a high risk of AMD progression for you. Your doctor might recommend starting preventative measures sooner, like lifestyle changes or nutritional supplements, rather than waiting for symptoms to appear.
That makes sense. Catching it early could make a big difference.
Exactly. Early intervention is key to preserving vision, and on the flip side, if the AI predicts a low risk, your doctor might be able to reassure you and adjust their monitoring schedule accordingly.
So it could potentially save people unnecessary worry and treatment.
Absolutely. And beyond personalized treatment, AI could also help us discover new risk factors and disease subtypes.
How so?
By analyzing massive amounts of data, AI might uncover hidden patterns and correlations that humans haven't noticed before. This could lead to a deeper understanding of AMD and potentially even the development of new therapies.
Wow, so the possibilities are really endless.
They really are. And while we're on the topic of possibilities, there's another fascinating area of research where AI is making waves the use of eye movements to predict AMD risk.
But you're telling me our eye movements can reveal clues about AMD? How does that even work?
It turns out that even subtle changes in our eye movements can be early indicators of the disease.
So even before any physical signs appear in the retina, our eyes might be giving away the secret.
Exactly. Researchers are developing AI algorithms that can analyze eye tracking data, looking at things like how smoothly your eyes follow a moving target or how quickly they fixate on a specific point.
So the AI is essentially reading between the lines of our eye movements.
That's a great way to put it. And this approach could potentially lead to even earlier detection of AMD, maybe even before any structural changes are visible in the retina.
That's mind-blowing. It's like taking early detection to a whole new level.
And imagine the implications if we can identify individuals at higher risk of developing AMD before any vision loss occurs. We have a much better chance of preventing or slowing down the disease.
It's like stopping AMD in its tracks before it even has a chance to take hold.
Exactly. And this brings us to an important point, the potential of AI to not only predict but also prevent AMD.
Right. I'm all ears. Tell me more about prevention.
Right now, there's no guaranteed way to prevent AMD, but with the insights gained from AI, we could be on the cusp of a new era of preventative eye care.
What kind of preventative measures are we talking about?
Well, AI could help identify individuals who would benefit most from lifestyle changes like quitting smoking, eating a healthy diet rich in antioxidants, and protecting their eyes from harmful UV rays.
So it's about empowering people to take control of their eye health.
Absolutely. And AI could also help personalize those recommendations, taking into account individual risk factors and genetic predispositions.
So it's not just the one-size-fits-all approach.
Exactly. It's about tailoring the advice to each person's unique situation.
This is really exciting stuff. It sounds like AI could revolutionize the way we approach AMD, from prediction to prevention to treatment.
It certainly has that potential, and as the technology continues to evolve, we can only imagine the possibilities that lie ahead.
I'm curious, are there any challenges or limitations when it comes to using AI for AMD prediction? We've talked about the black box issue, but what else should we be thinking about?
That's a great question, and there are definitely important considerations to keep in mind as this technology develops. We'll delve into those after a short break.
Don't go anywhere, listeners. We'll be right back with more on the fascinating world of AI and AMD prediction.
We'll discuss the ethical implications, data privacy concerns, and the importance of ensuring equitable access to these groundbreaking technologies.
It's going to be a thought-provoking conversation. Stay tuned. We're back and ready to wrap up our deep dive into AI and AMD prediction.
We've covered a lot of ground, from how these AI algorithms are outperforming human experts to, the potential for personalized prevention plans based on your individual risk factors.
Yeah, it's been a truly eye-opening discussion.
Pun intended. Yeah.
Maybe just a little. But seriously, this technology has the potential to change millions of lives.
Absolutely. And while we should be excited about these advancements, it's also crucial to consider the potential challenges, and ensure responsible development and implementation.
That's a great point. What are some of the key considerations as this technology becomes more widely available?
Well, one important aspect is data privacy.
Okay.
These AI models require vast amounts of data to be trained effectively,
Right.
which raises questions about how that data is collected, stored, and used.
So we need to make sure patient information is protected and used ethically.
Exactly. And another challenge is ensuring equitable access to these technologies.
Yeah, that's a crucial point. We don't want to create a situation where only certain populations benefit from these advancements.
Right. It's essential that AI-powered AMD prediction is accessible to everyone, regardless of their socioeconomic status, location, or other factors.
So it's about making sure these tools are available and affordable for all.
Precisely. And then there's the ongoing challenge of explainability, which we touched on earlier.
Right, the black box issue.
As these AI models become more complex, it can be difficult to understand how they arrive at their predictions.
So how do we address that?
Well, researchers are working on developing methods to make these models more transparent so we can understand the reasoning behind their predictions. This is crucial for building trust and ensuring that these technologies are used appropriately.
So it's not just about the technology itself, it's about the ethical framework surrounding its use.
Absolutely. It's about finding the right balance between innovation and responsibility and ensuring that AI is used to benefit all of humanity.
Well said. As we wrap up this deep dive, I'm left with a sense of both awe and cautious optimism.
I agree, the potential of AI to transform eye care is immense, but we need to proceed thoughtfully and address these challenges head-on.
It's a reminder that technology is a tool, and it's up to us to use it wisely.
And to remember that technology is only part of the solution. Maintaining a healthy lifestyle, getting regular eye exams, and staying informed about the latest advancements are all crucial for protecting your vision.
Great advice. So to our listeners, we encourage you to stay curious, ask questions, and engage in conversations about the role of AI in healthcare.
Your voice matters, and together we can shape the future of eye care in a way that benefits everyone.
Thanks for joining us on this deep dive into the world of AI and AMD prediction. We hope you found it informative and empowering.